Welcome to Physics Wala MedEd. I'm Dr. Patil, and today I'm here to announce an exciting news. Now, all of us are fascinated by the lines, curves, and waves on an ECG. But unfortunately, when our relatives give an ECG to us and they want to have an opinion from us, we are completely lost, right? This is the story of most of the medical students, because the moment you enter into second year or third year, our friends and family start taking us very seriously. They think we are already half doctors, and then they want us to give an opinion on the ECG. But the reality is that even after completing MBBS, even after getting into MD medicine, or sometimes even post MD medicine, we find giving an opinion on ECG very, very difficult, right? Seems so? Well, so to solve that problem, we are going to launch a special dedicated series about how to read ECG. We will run it for maybe 20 to 25 sessions. Each session will last for only 15 to 20 minutes. In that 15 to 20 minutes, we will learn about one crucial or highly important aspect of ECG. Like one session can be about P waves, another session can be about Q waves, another session can be about the PR interval. So in that period, we will learn how to identify a normal wave or a normal interval, what are the expected abnormalities, and how to recognize them on the ECG, right? So why are we connecting today? To announce the launching of a special series about how to read ECG. When are we going to start? I'll soon tell you. But before that, let me ask you a question. ECG is difficult. So how many of you think this is true, and how many of you think this is a myth? If you're thinking it is true, ECG is difficult, well, let me convert it into a myth. ECG is not very difficult. Most of us, what mistake we do is, we want to begin learning the ECG from books or from sources which are a bit complicated. We should always begin learning anything which seems complicated from the scratch, from the ground level. We should start understanding how a particular waveform is produced on the ECG. And then from there, as we build up, things start becoming very easy. And I'm very sure 4 to 5 sessions down the line, all of you will start finding ECG is a cakewalk and it's not very difficult. So now, दिमाग से ये निकालना है कि ECG is difficult. We are committing to make it easy for us. So ये statement ECG is difficult, ये myth है. It is going to be a myth for us. Okay. क्यों? Because ECG में क्या है? We have P, Q, R, S, T waves. इन waves के साथ क्या हो सकता है? ये तो बड़े होंगे, छोटे होंगे, या flatten होंगे, absent होंगे. And then we have few intervals, like we have PR interval, we have QRS duration, we have QT interval. ये intervals बड़े होते हैं या छोटे हो जाते हैं. And then we have segments, like we have the PR segment, we have the ST segment. ये segment अपने baseline से नीचे आते हैं. Segment depression या baseline से ऊपर जाते हैं. That is segment elevation, ST elevation MI सुना है, right? इसके अलावा ज़्यादा कुछ है नहीं ECG में. So we are going to learn it in a very simple and methodical way. But how do you prepare for this series? हम series start करने वाले हैं from 24th of this month. But I want all of you to put little bit of effort so that once we begin the series, उससे हम maximum extract कर सके. Okay. Now what preparation I want you to do? If you want to learn ECG in very, very detail, right? Then I would recommend you to go through some books. Just keep them with you. Download कर लो या purchase कर लो. Keep them with you. There are two basic books. One is ECG Made Easy by Atul Luthra. बहुत simple Indian language में है. So it's very easy to understand. And then second one is John Hampton. And those who want to study it in more detail, there is one more book called Leo Shamroth. I don't recommend Leo Shamroth as of now for any of you because हम beginners हैं. So you can either go ahead with Atul Luthra or John Hampton. Okay. And there are plenty of online resources as well. Why do I need these books? Sir, आप तो पढ़ाने वाले हो तो मुझे books की ज़रूरत क्या है? You mainly need the books because whatever I teach you, I want you to do some exercises on the learning principles. Like आज हमने सीखा कि P wave abnormalities. Now you need to go through some ECGs to test whether you have understood the P wave abnormalities, whether you can recognize an absent P wave or a present P wave, whether you can recognize a tall P wave called P pulmonale, or whether you can recognize a bifid P wave called as P mitral. उसके लिए कुछ exercises होने की ज़रूरत है. So these books, whatever images they have, they can be your exercises, or online from Google, you can download plenty of ECG images, and whatever we learn, you can start practicing on those images. Apart from that, in this series I will definitely give you the notes के साथ हर session के बाद there will be 2 ECG exercises which you should go through. Okay, so then when are we starting this series? It will be started on 24th of this month on the PW MedEd YouTube channel. And to begin with, we will start with the ECG basics. So first session hoga ECG basics में. What are we going to learn in the ECG basics? How to analyze the ECG paper. Forget about the waves, intervals, segments. पहले ECG पेपर के ऊपर लाइंस का बेसिक इंटरप्रिटेशन क्या है, हार्ट रेट कैसे कैलकुलेट करना होता है, एंड हाउ टू रिकॉग्नाइज अ नॉर्मल साइनस रिदम एंड abnormal rhythms. We will begin from there, and then as we go further in the next session we will start talking about P wave abnormalities. Then we will talk about the PR segment abnormalities. After that we will talk about the PR interval abnormalities, and then we will go ahead with the QRS waveform and their abnormalities. Then we will talk about the QT interval and its abnormalities. Then we will talk about ST segment and its abnormalities. Then we will talk about the T wave and its abnormalities. And then after that, we will get into more complex ECGs like bundle branch blocks and arrhythmias and recognition of the myocardial infarction. So once all these sessions are completed, you should be able to deal with most of the ECG based questions in the NEET PG exam, your ECG spotters in your final prof viva, and for that matter, whatever basic ECG challenges that you are going to face in your clinical practice, you should be able to deal with. So please join with me on the PW MedEd YouTube channel on 24 to 25. The time and further series का एक timeline आपको share किया जाएगा, so you can keep a track of it and don't miss any sessions. And after every session, the session will include one title, what we are going to discuss, and then we will have ECG exercises, and we will also have some MCQs based on the previous NEET PG questions. So this is not only going to help you to learn ECG, but also be prepared for your NEET PG exams. And we will also discuss some Viva OSCE pointers that are usually asked in your prof final examination. Okay, so that's the plan, and I hope this is going to be useful for all of you. And if you want me to incorporate anything else apart from the plan that I have shared, you want a particular extra ECG related topic to be covered, ping me on the Telegram or just drop a comment below this video, and I will make it a point that we will include your needs. Okay, so let me just go through your comments. Prakash Saini, I'm doing good. Good evening, everyone. Good evening, everyone. Med student, I'm primarily focusing on the final prof students so that by the time you become an intern, you are ready with basic interpretation of ECG, and then final prof Viva OSCE mein 1 or 2 ECG based spotters or images may be kept. You should be able to deal with that. And then eventually सबसे बड़ा roadblock तो NEET PG exam है, वहाँ पे ECG based questions are very frequently asked. You should be able to deal with that. So this is one short solution for your final prof internship readiness as well as your NEET PG exam. Okay, so that's all I had today. I came today to announce this launch of the series, and don't worry about the Reed Harrison series. We will be continuing that parallelly. We will be announcing that again, the second series coming soon. So we'll be announcing that in a couple of weeks, and we will start with other important topics from Harrison as well. Okay, so see you on 24th Feb on PW MedEd, and we will begin with the basics. And all of you, a simple request, don't miss the first 2 or 3 sessions, because the solid foundation of understanding ECG lies in the basics. So don't skip that, right? So I'll see you soon. Till then, have a good time. Bye-bye. Thank you, everyone. Thank you.